This presentation aims to raise awareness that pressure injuries are preventable and to encourage the use of a simple, evidence-based bundle of preventative care. Every year, there is a worldwide Stop Pressure Injury Day to raise awareness that pressure injuries are preventable. Everyone from the people at risk of a pressure injury, their family and whānau, carers, health professionals, managers and board members have a role to play in working together to prevent pressure injuries. Pressure injuries can happen to anybody at any age. The key risk factors for pressure injuries are 1. Reduced mobility, especially people who are confined to bed, use a wheelchair to get around, or depend on others for everyday care. 2. Circumstances that affect the health of the skin, such as incontinence, moisture, edema or swelling, age, some medications, for example steroids. And 3. Conditions that affect blood flow to the skin, such as diabetes, vascular disease, poor nutrition and infection. Several groups of people are particularly vulnerable to developing pressure injuries. These are neonates, those with a spinal cord injury, the elderly, children or adults during palliative care, the critically ill, and obese people. Being underweight is also a significant risk factor for developing pressure injury. Validated risk assessment tools like the Braden, Norton or Waterlow scales should be used for initial and ongoing assessment. While these guidelines will fit the vast majority of clients, it is imperative that you use your own professional judgment to assess risk and implement preventative strategies. Warning: the next slide contains pictures of pressure injuries that may disturb some viewers. A pressure injury is defined as a localized injury to the skin and or underlying tissue, usually over a bony prominence, as a result of pressure or pressure in combination with shear. Pressure injuries can significantly impact on a person's well-being, causing pain and affecting mobility and sleep. Pressure injuries can take many months to heal, if at all. They can become infected and malodorous, lead to loss of function, amputation, and even death. Evidence from around the world shows pressure injuries are preventable. Awareness is the first step to prevention. Pressure injuries are classified into one of 6 stages depending on the level of tissue damage. Stage 1. Intact skin with redness that doesn't go white when light finger pressure is applied for 3 seconds. The redness is in a localized area, usually over a bony prominence. Stage 2. Partial skin loss with a shallow open red-pink wound or serous fluid-filled blister. Stage 3. Full thickness skin loss. Fat may be visible, but bone and tendons are not. There may be dead tissue known as slough in the wound, but you can see how deep the wound is. The depth of the wound can vary depending on the location. Stage 4. Full thickness tissue loss with exposed bone, tendon or muscle. Some injuries are unstageable because they are covered by dead tissue that may be yellow, tan, grey, green, brown or black. When you see a localized area of purple or maroon colored intact skin, suspect a deep tissue injury. Stage 3, Stage 4, unstageable and suspected deep tissue injury are serious harm. They should be reported and their root cause investigated by a senior clinical manager. The Skin Bundle of Preventative Care identifies 5 key strategies for pressure injury prevention: support surface, skin inspection, keep moving, incontinence, nutrition. Every time a person's care is transferred to you, ask, is this person at risk of a pressure injury? And is the Skin Prevention Bundle of Care in place? Think Skin at nursing handovers, on transfers from paramedic to emergency department, on transfer between the ward and theatre and back again, on discharge from hospital to home and district nursing services, or on discharge to residential care, at handover to an occupational therapist during rehabilitation. These points of transfer are numerous. Take a moment now to consider that when a person's care is transferred to you, this is an opportunity to assess their risk for pressure injury and implement the Skin Bundle of Preventative Care. Support surface. Pressure injuries can occur very rapidly, often within 2 to 4 hours. So it is important people at risk of pressure injury are supported on surfaces that help reduce pressure as soon as possible. On completing a risk assessment with a validated tool, people at high risk should use higher specification foam mattresses rather than standard hospital foam mattresses. A pressure redistributing seat cushion may be required when sitting in a chair. For high-risk patients in the operating theatre, consider use of some form of pressure relief. The principles of safe manual handling and manual handling aids like lift sheets or mechanical lifts should be used to reduce friction and shear when moving people from one position to another. Skin inspection. For people at risk of pressure injury, skin inspection must be ongoing, at least every day or whenever the patient's condition changes. Inspect all skin because pressure injuries can occur anywhere on the body. Special attention should be given to looking at common risk areas for signs of pressure injury. These areas are usually bony, like elbows or heels, but can also include more padded areas such as buttocks and hips. Remember, there are many things that can put pressure on the skin, such as medical equipment, tight shoes, clothing, wheelchair foot plates and armrests, hearing aids, and glasses. Look for redness that doesn't go white when light finger pressure is applied for 3 seconds. This redness is called non-blanching erythema, and it is an important sign of pressure damage. In people with dark skin, this redness is not so easy to spot. Instead, you need to look for a change in skin tone over the pressure area. The area may also feel warmer or harder to touch. As well as redness, look for any blisters, abrasions, and black or purple discoloration to the skin. Document that the skin has been assessed. Document the condition of the skin. Document the stage of any pressure injury identified, and if necessary, ensure the person responsible for the care plan is informed of any changes so the plan for care can be updated. Keep moving. Regular movement can greatly reduce the risk of developing a pressure injury. Even people on high specification pressure relieving surfaces require frequent repositioning. The frequency of repositioning should be determined with consideration of the support surface in use and the person's individual tissue tolerance, level of activity and mobility, general health condition, overall treatment objectives, skin condition and comfort. Regularly reassess a person's skin condition and general comfort to see how they are responding to the frequency of repositioning. Pay special attention to limiting the time an individual spends seated in a chair without pressure relief. And as previously discussed, always ensure correct patient handling techniques are used to reduce the risk of injury to the patient and to yourself. Incontinence and increased moisture. Any moisture, even sweating, will make the skin more fragile and vulnerable to breaking down. People with incontinence need an individualized continence management plan. Check regularly to ensure their skin remains clean and dry. Use a pH balance cleanser. Avoid massaging or rubbing of the skin during cleansing. Protect the skin with an improved barrier product if needed, and alternatively, consider using a skin moisturizer to hydrate dry skin. Use only one incontinence pad to reduce multiple layers, and do not use plastic draw sheets. Nutrition. Not eating and drinking well increases the chance of developing a pressure injury and slows the wound healing process. Those most at risk of poor nutrition are the frail elderly, people pre- and post-surgery, and people dehydrated from nausea and vomiting. You can assess if someone is underweight or overweight at a glance. As part of a comprehensive assessment, the weight status of each individual should be further assessed to determine weight history and identify a significant weight loss. This includes a person's ability to eat independently and the adequacy of their total food and fluid intake. Individuals at risk of malnutrition and individuals with an existing pressure injury should be referred to a registered dietitian. If a person has a poor appetite, then eating smaller appealing portions of food more often is a good approach to meeting nutritional goals. If nutritional requirements cannot be achieved by eating food, fortified foods and/or high-calorie, high-protein nutritional drink supplements should be considered. An adequate fluid intake is needed to maintain healthy skin. The amount of fluid required will depend on the individual's condition and goals. The adequacy of the fluid intake can be assessed by monitoring changes in weight, skin condition, and urine output. Additional fluid will be required for a person experiencing dehydration, elevated temperature, vomiting, profuse sweating, diarrhea, or heavily exudating or oozing wounds. The advice in this presentation is based on the international guidelines published in 2014. The quick reference guide of this document is available free for download from the New Zealand Wound Care Society website. A link to purchase the full guidelines is also available. This evidence-based guideline should form the basis for pressure injury prevention and management policy and protocols within any clinical setting throughout New Zealand. We encourage you to adopt a S-SKIN bundle approach of care to achieve preventative pressure injury management at your workplace today and every day in the future.